my name is Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, which is dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Dr. Lowrey Sullivan, who is Northwestern Medical Center's Chief Medical Officer, as well as he's a practicing physician with Northwestern Women's Health Services, OB/GYN, and Anna Gabaree, who is a supervisor of the Family Birthing Center and Respiratory Therapy. Today we're going to be talking about cesarean sections or C-sections. So that sounds like an exciting topic for today. So thank you both for joining me on this show. So as we get started, I think it's going to be important to have you talk a little bit about yourselves, about who you are and what you do for Northwestern Medical Center, and then we'll jump into our topic today.
Okay, well, good morning. Happy to be here today. As you mentioned, I'm Lowrey Sullivan. I'm Chief Medical Officer at the hospital, and in that role, I oversee a lot of the inpatient medical services that the hospital provides. But my main roots are with OB/GYN, and I've been in this community for approximately 18 years as an OB/GYN provider, and with Northwest OB/GYN.
Terrific, terrific. And Anna?
Yeah, so I'm Anna Gabaree. I'm the supervisor of the Birthing Center and Respiratory Therapy. I've been in the organization for approximately 13 years, and through those years I've worked my way up from nursing student to floor nurse on the Birthing Center, and in this role for about 3 years overseeing nursing functions on the Birthing Center and within respiratory therapy as well.
Great, thank you. That's wonderful. All right, so who's going to answer the question of what is a cesarean section or C-section?
Well, I'll start out with that, and Anna can always chime in unless we're going along here. So cesarean section is a type of delivery. It's considered an operative delivery, and the conventional vaginal delivery is a majority of deliveries, but a cesarean section is when incision is made in the abdomen to deliver the baby if there's complications related to the labor or complications related to the baby or the mother's health. And so it's an important technique available to obstetricians for safe and effective deliveries in certain circumstances.
Okay. Did he get that all right?
I think he did, yeah, okay. He did a good job.
Great. So how often are they performed as in relationship to the vaginal birth?
We think for about, as an overall C-section rate, they're about 20 to 25% at our hospital, but for first-time moms, it's closer to 11 to 12% of all deliveries. And so because there's repeat C-sections, if you've already had one C-section, a lot of people choose to deliver that method for their second delivery, the overall rate does increase.
Okay, okay. And how does that compare to other hospitals or locally or across the nation? Do you have a sense about that?
Yeah. So nationally, the overall C-section rate is about 30 to 32%. So it's quite a bit lower at our organization, and also within the state, where the state average is running about 27 to 28%. For first-time C-section, where NMC is running 11%, within the nation, it's about 20 to 22%. So I think, you know, we're doing a pretty good job, and it's been a really, it's been an effort between nursing and collaborative effort between nursing and physicians to really drive these rates down to do what's right for our families.
Mm-hmm, mm-hmm. And nationally, are they increasing, or what's the trend?
I think overall the trend is increasing over the last 15 to 20 years. We've seen a significant increase in C-sections. However, I think most areas are realizing that this is a concerning trend and making good efforts to curb and change that trend. So maybe we're seeing a leveling off of the C-section rate, but unfortunately it's still nationally high, as Anna mentioned, at about 32%. And we'd like to see that diminish over time. Mm-hmm. So traditionally it's considered a safer and effective, vaginal delivery is obviously the optimal for most families. Right. And we think it's what's safest for mom and baby, but there are certain circumstances where a C-section is necessary. But really evaluating all the clinical conditions and if possible, moving towards a vaginal delivery is obviously optimal.
So does the patient get involved in making a decision in regarding having C-sections, or what's that look like, the education and communication with the patient?
Well, so C-sections are done for a number of different reasons, and you think if you're going to put them in general categories, you think about arrest of progress in labor is one of the most common, where the mom is in labor on her own and just not making appropriate progress. And we think in these arrest situations, over a period of time, there can increase risk to moms and babies. So that's one consideration. Another consideration is if we feel like the baby isn't tolerating labor adequately. And so we're seeing fetal heart rate changes during the course of labor, some concerning trends, and then that will also be an indication for a C-section. So depending on the indication, the mom definitely has some impact on that decision. And short of true emergencies, it's always a communication with the mom and the family about the care plan for her and her baby. So they are very much involved in the whole process.
And I would say that's one of the strengths of our OBGYNs that deliver at our organization. From a nursing perspective, they're very good at communicating with the patient and families, and explaining why things are happening and how they feel about what's happening.
So, and I think to give kudos to Anna and her group as well, one of the successes we've had for decreasing the C-section rate is a lot of education for the patients during labor itself. So labor is not a static process, and when women come in labor, we want them, it's a dynamic process, we want them up, moving, changing positions, and all these various things have been shown to significantly decrease C-section rate.
Wow.
And I think that's been our greatest success over the last 5 years to decrease our rate. So having the nursing staff really informed, educated, and then translating that education onto their patients has made a huge difference in our C-section rates.
Wow, and like you said, we're lower than the state and we're lower than the nation. So sounds like some of these little tricks are really helpful in getting the patient involved. So hey, congratulations, that's really awesome to hear.
Yes.
So what about for the mom and the, so now we're having a C-section, so what is it, so you know, is the significant other available? What's the experience for the C-section? Because I'm sure you're trying to make it as kind of normal as possible, because everybody kind of expects a vaginal delivery unless it's a repeat. So how do you make that experience as much as normal as possible?
Yeah, so I can talk about that a little bit. So we really try to provide a patient-centered approach to care, no matter vaginal delivery or C-section, and we're trying to incorporate elements of what's called a gentle C-section, which has been a really neat transformation that we've seen happen in the OR. So there's a few key elements that we've adopted in our organization. The first one, it sounds silly, but nationally and still within the state of Vermont, some organizations mandate that mom's hands have to be strapped down during the C-section to keep them on the table and keep them safe. We now allow moms hands free, so they're able to immediately hold their baby after delivery. Nice. So that kind of leads into the next piece. Is the baby is born, it immediately goes skin on skin with the mom, naked baby on mom's naked chest, where they can sit there and bond and kind of have those first moments like with a vaginal delivery. And mom can even start breastfeeding their baby in the OR if they choose as well. The third really neat thing, I think, is we have these awesome drapes that can be clear, so mom and her support person can watch the baby be born if they choose. And if they choose not to, the drape can be covered. So really it's about providing families choices around their birth experience, whether it's vaginal or C-section. And the final key element is that the family's never separated.
Nice.
So the support person, significant other, baby, mom, they all stay together for the whole surgery and then for the whole recovery period after.
Yeah. I think it's all about a balance between a sterile operative room and operation environment where we want things to be safest for mom and while she's having a real surgery, but at the same time focusing on those elements that are really important to the family in those early bonding stages. So as Anna outlined some of the principles around a gentle C-section, we also maintain the sterility of the surgical environment to really optimize both aspects. So
it seems really special, you know.
Important balance between those two.
It's terrific. So, what's the recovery like with a C-section?
So I can talk on the initial recovery period. So mom and baby and support person will stay together for the remainder of the surgery, and then they'll move together to the birthing center where they go into their official 2-hour recovery period. You know, during the 2 hours, baby will stay skin on skin and breastfeed, and the nurses are ensuring mom's safety and baby's safety through assessing vital signs, checking mom's uterus, listening to baby's lung sounds and heart sounds. All while supporting breastfeeding and educating. And the other really key piece is we ask our visitors to respect mom and her significant other's privacy during that time so the baby can get to know their family. And it's one thing I found interesting doing some literature review is it's a really important time period in baby's development. Protecting this 2 hours both physically and psychologically. There's some really important milestones that happen in the first 2 hours with short-term and long-term benefits for baby's health. So we just ask visitors stay away so we can respect personal privacy for the mom, her support person, and the baby during that time.
And so from a surgical standpoint, it is a surgery, and so we have to be cautious about recovery from surgery. But as Anna pointed out, these are cases that are in general done on young, healthy women who will bounce back from surgery incredibly well.
Sure.
So we want to maintain adequate pain control from a surgery, but at the same time, we don't want to overdo it. So we have techniques to minimize the amount of narcotics we're using to keep moms comfortable, keep them up and moving. They do have to take it a little easier over the first 6 weeks in the normal healing process, but moms are really mobile. They're able to be up, moving, do all the care for their child that they would need during those initial weeks after having a C-section. So again, patients are healthy, they do really well.
Excellent. Sounds terrific. So if you've had a C-section, if you have another child, can you have a vaginal birth, or how does that work?
Yeah, absolutely. And over the years, the impetus to encourage vaginal delivery after a C-section has kind of risen and fallen and is rising again. So there was a big push about 20 years ago to really focus on this and as a method to decrease C-section rates. And then there were some complications that came from attempting vaginal deliveries after C-sections. So the key is to choose the appropriate candidates, really work with the mom, review the risks and the benefits, and I think the benefits generally far outweigh the risks, and that's what we're feeling at this point. So we are, currently in a mode of encouraging this again and thinking it's a good idea for appropriate candidates, so we can kind of weigh the risks and benefits. Terms you'll hear out there if you're doing research on your own is VBAC, which stands for vaginal birth after C-section, and a newer term is called TOLAC, so TOLAC, which is trial of labor after C-section. So it's just a matter of perspective whether you're trying or whether you've succeeded. So if you're doing some research on your own, you'll see both those terms out there in the media and the literature. So.
And I would just encourage families, if they've had a C-section, to ask if they would be a candidate. Ask their doctors during their pregnancy and kind of make a plan from there.
Yeah.
So it sounds like the plan is really personalized for their experience, and that the family is really involved. And it sounds like you're wrapping around them, whether it's through a vaginal birth or through the C-section, and it's really their story that you're creating.
Yeah, that's absolutely our goal, is to really provide a safe but meaningful birth experience for any mom, any family. And so again, the focus is on safety, but at the same time, the importance of that moment or that experience for any family, whether it's your first child or whether it's your 5th child, it's still a very important experience.
Yeah.
So we want to optimize that for the whole family.
Absolutely.
Yep.
So tell me about baby-friendly designation. So I'm going to say congratulations, and you're going to tell our viewers what that is and why you're so proud of having that designation.
Yeah. So this has been a huge endeavor for our organization. So Baby Friendly is a program established by the CDC and the World Health Organization to really promote best infant feeding practices and to promote healthy starts for moms and babies. A lot of times when you hear baby-friendly, you think of breastfeeding immediately, and while there's a lot of breastfeeding education done in baby-friendly, there's so many more components to baby-friendly, like skin-on-skin and the health benefits of that, reducing pain, regulating heart rates, regulating temperatures. Then there's 24-hour rooming in where babies don't get separated from their families anymore. Cue-based feeding, it doesn't matter how you're feeding your baby, you're going to feed your baby based on their hunger cues. You're not going to watch the clock and put them on a schedule. That can help to prevent overfeeding or underfeeding. There's also a huge element of higher education for baby-friendly organizations. All nursing staff and physician providers who care for mothers and infants have many more hours than would typically be standard for an inpatient unit for infant feeding practices. There's standardized policies, there's organizational orientation to the infant feeding policies. It's a really cool program to bring us to a higher level of education as providers and to be able to educate our families on providing the best start for their babies.
Yeah. So it's clear Anna's very passionate about this, and which is wonderful, and listing off that huge list of benefits of baby friendly. But it has really been a great experience for the whole medical community. It involved the OB/GYN docs, but also the pediatricians, the nursing staff. So it really included a lot of different people. So educating us as providers so that we could then better educate families and moms. So it really has been a great transformation to, support our services here.
Exactly. It really sets us apart from others, right? I mean, there's not how many designations in the state of Vermont?
There's only one other.
Yeah.
Yep.
Was that St. Johns Ferry? Is that right?
Johns Ferry, yep.
Yeah. So, congratulations.
Thank you.
You're the top of the pack. So, thank you so
Great
much.
accomplishment for Anna's team. Yeah.
Yeah. So, thank you both for being here. Our time is up. It flies when you're having a wonderful conversation. So, thank you very much. Thanks for the great work you do in caring for our moms and their families and the new babies that we're bringing into our community. So, it's great to have you here.
Well, thank you for having us.
And I'm Gabriel, Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show. We've had a wonderful conversation about C-sections, and we brought this conversation to you because we heard feedback from our community that maybe we do a few more C-sections than others. And it was great to hear the results today that actually we have less C-sections than the state and also in the nation, and we're working even harder with our families to try to reduce that number. And it really is about the personal experience for you to enjoy with your family. So thank you for joining us today.